Has your life been seriously impacted by the COVID-19 virus? If so, you're not alone. I'm Dr. Jason Bradley, and today I would just like to talk with you a little bit about some real numbers and the possible implications of those statistics, and also share with you some simple but amazingly effective things that you can do for yourself and your family that can lower your risks and the risk factors associated with developing serious complications and even death from this virus. The COVID-19 virus is also known as the novel coronavirus 2019. Novel meaning new. This is a new virus that we don't have a lot of data on, and we certainly don't have long-term studies on. That's why we're all being very cautious. The coronavirus, however, has been around for a very long time. The coronavirus is the virus of the common cold and upper respiratory infections that we've probably all had at one point in our lives. This is just a new version of it. And then 2019, because it was first discovered in Wuhan, China in 2019. The first case that tested positive in the United States was on January 21st. A gentleman had returned from Wuhan, China to Washington State and tested positive. But I want to jump right into the numbers because I think they're staggering. There are 327 million Americans. Out of that 327 million, roughly 1/3 of us are expected to develop this virus, contract this virus very quickly. That's about 108 million Americans. Out of that 108 million, 60 to 65% are considered to be higher at risk or more at risk because they're carrying risk factors or comorbidities that place them at risk for complications, including death. Those risk factors include things like being immunocompromised, being on immunosuppressive medications, autoimmunity, diabetes, heart disease, high blood pressure, high cholesterol, high blood sugar, being overweight or obese. That's 60 to 65% of Americans right there. Having chronic lung infections, COPDs, asthmas. And I think that you can hear what I'm saying, that that's a large swath of the American population. So when we take that 65 million folks that are most at risk, that have developed or potentially could develop the disease, and then we apply the current mortality rate of 1.3%, even though that number sounds like a small number, 1.3%, when you apply it to 65 million at-risk infected Americans, it puts the potential death toll at 830,000 Americans. Even if we age adjust that to those Americans that are 65 years and older, about 15% of the population, that's still 125,000 potential deaths. So again, 1.3% sounds low, but when you apply it to our large population, the numbers are scary. The CDC stepped in with some great guidelines. Practice social distancing. The reason that we're doing this is that it slows down the spread of this virus. The virus is going to spread, but by slowing it down, we're able to not overwhelm our taxed medical and hospital systems, like we saw in Italy. That's good practice. Washing your hands with soap and water. That's also good practice. The virus itself is actually quite simple. It's a piece of genetic material called RNA surrounded by fat and protein. When we wash our hands with soap and water, the soap breaks down the fat, exposes the RNA, and the virus is destroyed almost immediately. We need to disinfect and clean surfaces and our clothes regularly because the virus can live on surfaces for some indeterminate periods of time. If you're feeling sick at all, stay home. And certainly if you feel like you need to seek care, seek care. Cover your nose and mouth if you do cough or sneeze. And again, if you're going to be exposed to the public, and certainly those that are most at risk, please wear a face mask. Those face masks prevent you from spreading the disease to others. You might be a carrier and you might not know it, so that's very important. But really what I want to talk about is things that you can do right now for yourself and your family to reduce those risk factors that we mentioned, and again, not develop complications related to this virus. So those risk factors, again, are being immunocompromised, being on immunosuppressive medications, having an autoimmune disease, diabetes, heart disease, high blood pressure, high cholesterol, high blood sugar, being overweight or obese, cancer, recovering from cancer, chronic lung infections, asthma, COPD. We have been instructing our patients to really focus on 5 main things that you can implement right now that don't cost anything except just to remember to do it. Number one, I want you guys to hydrate. A dehydrated body is much more prone to infection. 85% of Americans are considered to be dehydrated, despite the fact that we drink copious amounts of coffee, sodas, sugary drinks, and energy drinks. I'm asking my patients to just focus on drinking water, and that's great advice for you and your family as well. I also recommend eating real food, getting rid of the boxed, canned, wrapped, packaged, and processed foods that are actually weakening our systems and weakening our immune systems, and focusing on eating real whole foods, things like vegetables, healthy fats, healthy proteins, berries, fermented food, and again, drinking water. I'm also recommending that my patients move for about 30 minutes a day. If you can get out and walk for 30 minutes in the sunlight, that's great advice. The coronavirus doesn't like sunlight, so get out and move if you can, still practicing social distancing. If you can't get outside, I've been telling my patients to just move around their house. Walk from the living room to the kitchen and back for 30 minutes if nothing else, but get up and move every day. Practice some stress management. Stress reduces the immune system function as well. This has been well studied and well documented. I've been recommending that my patients take 10 minutes in the morning and 10 minutes in the evening to do some stress management. If nothing else, just breathe. You could do some meditation, mindfulness, deep breathing, prayer. I practice gratitudes where I just make lists in my head of things that I'm grateful for and just really try to focus on those things. And you can do that as well. And then lastly, I've been recommending getting a good night of sleep, but having a good sleep routine. Shutting the screens down an hour before bed, turning out the lights at the same time every night, sleeping in a dark environment, and waking up at the same time every day, really trying to get a good amount of sleep, because again, a sleep deprived system is also prone to more infections. So guys, again, I'll just cover those very quickly. Drink water, eat real food, move, practice some stress reduction, and practice good sleep hygiene. Those are things that you can implement right now with your family and yourself, and share it with your friends and loved ones, because those 5 pillars will reduce the majority of those risk factors almost immediately. Change takes time, but the more consistent that you are with those practices, the more those risk factors are going to come down. And ultimately, I hope this is a wake-up call for all of us that health doesn't come in a pill, powder, potion, or otherwise. It really is something that you're in control of. You're in control of these 5 pillars, and you can implement them right now. And it may not only improve your life, but it may genuinely save your life or the life of your loved ones. I hope that that helped. And I do think that in the end, we are going to come together and we're going to realize that we are just, one human species on this planet. And I look forward to the day when we're past this, and I send you all love and light. Thanks for joining me.